Number of visits that a patient may have during her obstetrical course can vary. I think for your non-high risk basic patient, 13 has been kind of the number. You have your initial visit. Typically we see patients every 4 weeks up till about 28 weeks. Then we start to see them every 2 weeks up till about 34 weeks. Then we start seeing them weekly between 34 and 36 weeks till they deliver. And it generally comes up at around 13 visits, all included. Now, sometimes there'll be additional visits for ultrasounds, or if you're a high-risk patient who may have preterm labor issues on medications, we sometimes watch those patients a little closer. So it can vary, but on average, it's supposed to be around 13 visits.
The misconception a lot of people have is that their parents or maybe their grandparents never went to an obstetrician or a doctor for their pregnancy, and in the majority of cases everything does turn out fine, but there are a number of advancements that we've made in healthcare and medicine that will allow us to determine and diagnose conditions that, if left undiagnosed and untreated, could cause serious effects for your baby developing, as well as for you yourself, that could sometimes even mean a life and death situation. So it's very important to be able to be seen early in the pregnancy and throughout your pregnancy to be sure that you're not at risk for any of these conditions.
There are a lot of people who have problems and don't realize they have problems, and our goal is to hopefully pick those symptoms up early so that we can assure them that they get the healthiest baby they can. Most people would recommend good prenatal care to reduce the likelihood of preterm deliveries, infant mortality, and those kind of things, because when it doesn't go well, and if it was a process that could have been prevented, that's when it really becomes unfortunate.
A lot of people will miss certain visits, and there's certain things we need to do throughout the pregnancy, such as checking blood glucose, doing the Down syndrome alpha-fetoprotein test, checking amniotic fluid, and these are things that need to be done at certain milestones, checking mom for group B strep, even checking the heart tones and making sure that the baby is growing properly. So it's really important to be consistent with those doctor visits and making sure that you stick to the regimen your doctor and you come up with.
If you have cold or flu, cough symptoms, or fever, there are a variety of over-the-counter medications that are readily available and very safe in pregnancy, but it's something, again, you're going to want to check with your obstetrician to be sure that it is something that they recommend as being safe.
But there is a list of medications we typically would use. Tylenol we prefer over top of aspirin or Motrins. You can use those, but they cause thinning of the blood a little bit, so we try to avoid those just like we do before surgeries. But Tylenol extra strength, Tylenol flu, Benadryl, antihistamines, most all of these medications are safe in pregnancy.
We do not recommend you treat yourself. Now, studies have shown that Robitussin has been fairly safe and Tylenol has been fairly safe, but we recommend you talk to your doctor before you take any over-the-counter medications.